know why.
Okay.
Me too.
Hi, I'm Laurie. I'll be your nurse today.
Here.
We're just going to do a few quick checks of your neurological status.
Okay.
I would like to video this assessment, if you don't mind.
Absolutely no problem at all.
Okay. And so, I'll just get you to sign this consent form.
Okay.
And while we do that, just tell me the date.
It is October 23rd, 2013, on a Wednesday.
Okay. And do you know where you are?
Rome, Georgia, at Redmond.
Okay. When we go through this, we're just checking the cranial nerves.
Okay.
They're all easy tests. Nothing's painful. It's just some simple commands. The first nerve is the olfactory, which is your sense of smell.
Mm-hmm.
So if you'll just place a finger on each side of the nose and sniff, and on the other. And I'm going to ask you to smell something familiar, and you just identify it.
Okay.
If you'll just close your eyes.
Cinnamon.
Okay, great. The next nerve is your optic nerve, which is your actual vision. And in some settings, we would do the chart that you would read, like if you were at the ophthalmologist or optometrist office. But here we're just going to do something basic, and then if we need to do further, then we would have to go further.
Okay.
So I'll just get you to cover one eye,
Uh-huh.
and just tell me how many fingers,
2,
and switch out eyes.
4.
Great. And let me get you to just read it. Are you able to read
Yes.
the written word? Okay. If you'll just read number 5 for me.
How to be a star parent.
Which we all need to be.
Absolutely.
The next nerves is 3, 4, and 6, and that is the muscles for the eye.
Okay.
So we're just going to see how all they work well. So the first one is your pupillary response. So if you'll just look at me, I'm just going to shine a light. It's not bright. Just see how you react. We just want to make sure that they're symmetrical, there's no nystagmus or anything like that.
Okay.
And then we're just going to do the cardinal fields of view. So I'm going to ask you to just follow my finger without moving your head.
Okay.
That's great. And when you do that, you're just making sure that they're moving equally and reactive appropriately. The next one is your trigeminal nerve. That is your sense of whether something's soft or sharp, dull. So I have a cotton ball and a gym clip. And we're just I'm going to ask you to close your eyes, and I'm going to touch you. And you just tell me whether it's sharp or dull. Okay?
Go ahead. Soft. Sharp. Sharp. Soft. Soft. Sharp. Sharp. Soft.
Okay. Great. Now, the next one is your facial nerve. That's just the muscles and how they move. I'm going to get you to close your eyes tight and squint and puff out your cheeks. Great. The next is your acoustic. That's just how your hearing is. And so we can just do that with a simple basic test. I'm going to say a few words and you just repeat.
Okay.
I'm just going to step back here so you won't be able to read my lips.
Okay. Ball. Red. Horse.
Great. We're going to do another one, which is your glossopharyngeal. That's the movement of your tongue and swallowing. And we also check for how well you taste. So I'm going to let you taste something, it's a familiar taste, and I'm also going to feel as you swallow.
Okay. Lemonade.
Okay. That's important to check if you've had some kind of neurological event or stroke, because we always check swallowing to make sure you don't aspirate anything, because we don't want you to have any kind of pneumonia problems on top of what else is going on. The vagus nerve is the next one, which is 10. That's your gag reflex. And so I'm just going to use this tongue depressor and try to stimulate that.
Okay.
Sometimes that is activated. You might have heard it called vageling down. Sometimes there are people who have that flight or fright where they get real scared and they just heart, racing and all kind of things. If you bear down, like you're having a bowel movement, it'll slow your heart rate down. And so sometimes in the hospital they'll ask you not to do that. The other 11 is the 11th spinal nerve is the spinal accessory nerves and has to do with this complex of nerves here. We look for symmetry in the muscles, make sure you're not using these muscles too much to help breathe, and if you are, they will get big. And so I'm just going to assess the strength by asking you to push up, and then you're just checking to make sure that strength is equal on both of those. And then the hypoglycemic is also your tongue and its movement. I'm going to just ask you to stick your tongue out, and I'm going to press against it, and you push it. There you go. And again, and you want to make sure that strength is equal. To make sure that it moves appropriately also, I want you to say light, tight, and dynamite.
Light, tight, dynamite.
Great. You did great. They all seem to be working appropriately, and no more in-depth testing is needed.
Okay.
All right. Thank you.
Thank you. I appreciate it.
Mm-hmm.